You sent me a study today talking about curry spice, and there's something in curry that does something for your inflammation.
Yeah, so again, we've talked about turmeric a lot.
Turmeric.
Turmeric as an anti-inflammatory. Not a great study in that it wasn't applied to a bunch of people with tendinitis. It was actually in the lab showing inflamed tendons and showing turmeric's ability to actually calm the inflammation.
Okay.
So we often use turmeric for digestive inflammation. We use turmeric for joint inflammation. We've always sort of extrapolated that and said, you know what, any kind of inflammation, it's probably going to be helpful. Here's a little more data to support actually tendinitis. So those types of injuries, whether it's elbows or knees, turmeric is a really good option for that. It will suppress the inflammation response.
Okay.
The other big advantage is the lack of side effects. You know, the anti-inflammatories, ibuprofen, naproxen, not just ulcer causing, elevates blood pressure, increase the risk of heart attack. Now we know it also depletes folic acid, which is a B vitamin, depletes melatonin, which may impact sleep.
Sure.
Lots of side effects of those anti-inflammatories. Turmeric, we don't have those things. It actually is improving the digestive health, and so it may lower the risk of heart attack. So it's you know, it's a big one. It's a big one.
And so this is more data to support that this is effective, especially with tendinitis.
Right. I mean, just sort of using it as a broad anti-inflammatory, whether it's an injury, whether it's recovering from something, whether you have chronic illness. You know, I think turmeric needs to get a little bit more play, a little bit more popular.
Okay, but we're not talking about eating a lot of curry dishes or sprinkling some turmeric in your soup. I mean, that's not going to cut it. You're talking about maybe capsules of this stuff?
Well, you know, in this study, it was just the spice, so you know, it wasn't the heavy dose supplement. So you can get benefits just by consuming turmeric as a spice. I think it's a great idea. Eating more, you know, curry-based dishes, using it as a seasoning places. But you know, if you need a greater anti-inflammatory impact, you know, I think supplementally, you know, one capsule of turmeric, especially if it's 95% curcuminoids, which is the active component, that's what you want to look for in a supplement. Okay. You're literally getting a mound of spice in a capsule, so you know, really going to help with that anti-inflammatory benefit. And
swallowing it, not necessarily having it sit on your tongue and do the impact that way.
Exactly. Unless your tongue's inflamed, then maybe it would have some benefit.
You never know.
Right.
Okay. Study that. Get back to me on it.
Right.
Let me know.